Dr. Jay Bhattacharya is a Stanford University medical professor. He's been investigating the death rate from coronavirus, a fascinating and important number, and he joins us tonight. Doctor, thanks so much for coming on. What are you concluding about the real death rate, the actual death rate from this virus?
I think based on the evidence I've seen so far, it's likely orders of magnitude lower than the initial estimates. The World Health Organization put an estimate out that was, I think, initially 3.4%. It's very unlikely that it's anywhere near that. It's much likely, much closer to the death rate that you see from the flu per case. The problem, of course, is that we don't have a vaccine. So in that sense, it's more deadly and more widespread than the flu.
Right.
And it overwhelms hospital systems in ways the flu doesn't. But per case, I don't think it's as deadly as people have thought.
I know that it's very hard to come up with any kind of firm numbers in the absence of widespread testing. But do you think it's likely that there are large numbers of Americans who've been infected, recovered, and didn't know it?
Yes, I believe that is true. In fact, we're going to start to know that very, very soon. I've been working on studies with some colleagues of mine in Santa Clara County, in Los Angeles County, and then also a large nationwide study working with Major League Baseball employees, not just athletes, but all the employees. Very soon, we're going to have, I think, a much more accurate understanding of how widespread this is. And then we'll, as you said it very well in your introduction, we'll also know much better how deadly it actually is. Evidence from around the world is flowing in, and it really seems like there's many cases of the coronavirus that we haven't identified with the testing regimens that we've had around the world. Many orders of magnitude more people have been infected with it than I think that we realize, and that, as you rightly pointed out, means that the death rate is actually lower than people have realized, also by orders of magnitude.
So one of the destructive byproducts of this pandemic is fear, which is itself, I would say, it clearly is hurting people. You're an American, in addition to a physician and a researcher. Based on the research that you have done, are you more afraid or less afraid than you were when you began?
I'm less afraid than I was when I began. I've heard so many stories of people who can't hug their grandkids. We're scared to hug because they don't want to get the virus from their kids because they're older. I've heard lots of stories of husbands and wives that won't hug each other because the wife is a nurse and the frontline worker. I think this understanding really the true death rate. If the death rate's somewhere near 1 in 1,000, would you not hug your wife? I mean, if it's 3 in 100, you act very differently than if it's 1 in 1,000. So I'm hoping once we get accurate numbers in place, we'll be able to really sort of quell the fear that's out there.
Boy, that is one of the most reassuring things I've heard in a long time. Doctor, thank you truly for coming on tonight. I appreciate it.
My pleasure.